Hi, my name is Antonia, and I have prepared a presentation about anti-obesity drugs and medication. So there are every year more and more individuals with obesity. Medical sector and entire world realizes that intervention and treatment are necessary to help reduce these numbers. The World Journal of Men's Health included in one of their articles that even though lifestyle modification with calorie restriction and engaging in physical activity is known as first approach to decrease obesity numbers, this, according to long period studies, can be unsustainable and very challenging for a lot of patients. So currently most guidelines recommend pharmacotherapy and using drug as a second-line treatment for weight management and also lifestyle modification with people with obesity. The research has been focused on developing anti-obesity drugs. There have been many of them developed and tested, while most of them work on targeting different pathways in organism, helping with balancing energy. But most of them are considered unsafe with negative side effects. Some has already been approved by FDA and are relatively safe with not much cases with side effects and seem as a starting point for bright future with anti-obesity drug. These are mostly GLP-1 drugs, which are shown in research and longitudinal studies to help lose weight with no side effect, as well as have other positive effect on health and can be as useful as bariatric surgeries, for example, with losing weight over the time, but are less invasive, but they have one big problem as far as for right now, that they are very expensive and not available to the public and not covered by insurance companies. So as I said, there is a couple of drugs approved. So let's take a look at them. So first one is called Orlistat, which was first approved anti-obesity drug for long-term use by FDA in 1999. It is available over the counter and work as a non-central nervous system agent, reducing calorie absorption. The main mechanism is the inhibition of lipases, which leads to around 30% decrease in absorption of triglycerides and thus calories. Orlistat is expected to have little effect on weight loss with non-fatty food consumption, but its side effects are associated with GI system and most anti-obesity drugs. In the Xendos trials, trials were tested for 4 years and were compared with placebo group. This drug showed weight reduction and also significantly lowered the risk of type 2 diabetes, improved blood pressure, insulin sensitivity, and lipid profiles. On the other hand, this study also showed that 91% of participants experienced at least one gastrointestinal event and 8% had to withdraw the study. So there are concerns regarding the potential risk of colorectal cancer, as well as it was also observed that patients who were taking this drug had significantly decreased absorption of vitamins A, D, E, and K. Another one is called lorcaserin, and it is a selective antagonist of 5-HT2C receptors, which decrease food intake by increasing satiety through its serotonin effect on hypothalamus. Due to its high potential risk of cancer development, as shown in Camellia TIMI-61 clinical trials, which was a randomized double-blind placebo-controlled multi-center parallel group trial with 1,200 participants in 2014 to 2018. So during this trial in 2016, it was approved by FDA, but in 2020, after the trial, the FDA requested producer to withdraw the drug from market because of the potential risk of cancer development. So also lorcaserin failed approval from the European Medical Agency in the preclinical testing, even though it passed the FDA. And the data revealed the potential risk of different cancers, such as breast cancer, and also concerns regarding psychiatric issues such as depression or suicidal ideation. So the next one is a combination agent, phentermine topiramate, which was approved by FDA in 2012. And this drug suppresses appetite through mechanisms that are still not very clear. Long-term studies were conducted for weight loss efficacy in EQUIP and CONQUER tests, which were 1-year randomized double-blind placebo-controlled studies, and found that weight loss was on average around 9 pounds, as well as the results showed a significant improvement in blood pressure, lipid profiles, fasting glucose, insulin, and weight reference. However, European Medical Agency did not approve this medication because there is a potential of abusing it, as well as there is lack of long-term data on the cardiovascular effect and the cognitive side effects, such as language and impairment. And the common side effects of these drug are insomnia, dizziness, or constipation, and is not safe to take it in pregnancy. The other one is also combination agent naltrexone bupropion, and it's been approved by both FDA and EMA in 2014. And this drug serves as antidepressant and antagonist on opioid-dependent feedback loop. Typical side effects include headache, dizziness, and GI discomfort such as nausea, vomiting, constipation, or diarrhea. And also elevated blood pressure, so is not safe for patients with cardiovascular diseases. This drug was tested very positively in a reduction of weight. And this was assessed in a COR 4 phases or 3 multi-center long-term double-blind placebo-controlled trials. And the last one, I would say the most important for us right now, is called liraglutide, which is an injectable glucagon-like peptide 1 derivative that was approved by the FDA in 2014. GLP-1 mainly regulates blood glucose by enhancing insulin secretion from the beta cells of pancreas and inhibits glucagon secretion in a glucose-dependent manner. GLP-1 also induces postprandial satiety and fullness, slows gastric emptying, and decreases appetite and food consumption by acting on the hypothalamus, limbic system, and cortex. Liraglutide was tested based on the result of the scale trials, and one of the main benefits of this drug, beside the weight loss, which was between 5 to 10 pounds in 56 weeks, was shown to have very good positive effects on cardiovascular diseases in obese patients with type 2 diabetes. Also in children and adolescents with type 2 diabetes, and obesity, this drug was proved as beneficial for improving glycemic control. And there are consideration of some risk of acute pancreatitis and pancreatic cancer, but they were not supported, and with no other safety concerns, this drug can serve as a good option for obese patients and patients with mental disorders. But this drug is very expensive and requires daily injection. But if we can make policy changes and health insurance company would be able to pay for this drug, this can be a very good a drug for fighting obesity in adults, but also in children, because it wasn't shown in any study with any side effects, even there are some considerations that it can be something with pancreas, but nothing was proven. And this drug is also safe for people with other diseases such as cardiovascular or type 2 diabetes. So studies for children are often lacking data, as side or adverse effects are not reported, as well as the number of therapies and research on children is lacking behind when compared to adults. But positive news is that there have been done more and more recently, and there is a vision to increase the studies mostly in adolescent field in the future. But generally, after trials with medication studies, it was proved that first-line approach by lifestyle modification, a combination of diet, physical activity, and behavioral change is the best way to reduce childhood and adolescent obesity and improve quality of life by reducing chance for developing other obesity-related conditions such as insulin resistance, hypertension, problems with liver, and also improves exercise capacity. And even if there is the absence of sustainable weight loss, it has still a positive effect on overall health and health benefits. The number of medical options is slowly increasing every year for patients who can't change their lifestyle or who have severe obesity, but these second-line therapies can have side effects. So scientists are still working on developing more with less side effects. And also for research and daily use, it is very important to increase availability of medications with different mechanisms of action to be able to find an effective medication that is well tolerated and efficient in most patients, and especially in children and young people who do not achieve weight loss with medical management. There is still some options such as bariatric surgeries, even though they are not very supported in the pediatric age group. And long-term effects are still a little bit limited, and doctors just don't like doing bariatric surgeries on children because of the growth and still developing organisms. So as we can conclude from scientific research, it is evident that a new treatment strategy is necessary to support children and adolescents with obesity to reduce weight and decrease the number of patients with obesity-related health problems, diabetes mellitus type 2, or cardiovascular diseases. There are also various obesity phenotypes which affect the response to medication, and there are currently no recommendations based on class of patient for which anti-obesity drugs are more effective, and progress needs to be made in personalized medicine in this field. The identification of response patterns to specific anti-obesity drugs can increase the efficacy of the drugs, which will be an initial step forward for personalized medicine for obesity treatment. And developing anti-obesity drugs is mostly important for people who can't change their lifestyle or have like type 2 diabetes or cardiovascular diseases, which make it very difficult or impossible to change the lifestyle. So my opinion and point of view is that I'm a little bit concerned that when there will be effective drug preventing and reducing obesity with no side effects available to wide public, people may start misusing the effect of no weight gain, as is also one of the concepts of European Medical Agency, and people then won't pay attention to foods they consume. This may also bring numbers higher of binge eating behaviors. But on the other hand, as people would be more lean with less fat, they would do more physical activities, and it would be easier to move, and thus they will anyways improve their overall health and well-being, even if their diet is not as best as can be. And if these drugs would be available only with prescription and patients would be allowed to take them only for a certain period of time while they lose weight, this solution with strict monitoring and supervising by doctors would be very effective, I think, and would be very efficient for enhancing both physical and mental health, also well-being, boost up confidence, change lifestyle, and nonetheless reduce risk of developing obesity-related health problems such as cardiovascular diseases, strokes, type 2 diabetes, but also joint problems, and it would reduce pressure on our joints and bones, and would enhance every part of individual's life and physical abilities. To do so, anti-obesity drugs need to be more available to public. As far as for right now, they are very expensive, which make them unavailable or available just to very rich people. And to start using them on daily basis would require healthcare insurance to change, also change in policy to make these drugs covered from the healthcare. This would decrease expenses for insurance companies on treatment for other diseases related to obesity, such as those cardiovascular diseases or diabetes. So reducing obesity in population will also lead to saving finances for treatment for obesity-related diseases in household, as well as in insurance and medical sector. And these saved finances would be able to go to research and treating other serious diseases such as cancer, which can also be caused by obesity and is increasing in rates every year. So there is a high potential that in the future, with some policy and insurance or health insurance changes, the insurance will actually cover the anti-obesity medication because they can save a lot of money on anti-obesity, save a lot of money on obesity-related health conditions and invest more into anti-obesity and improve overall well-being of everybody. But besides drugs or bariatric surgeries, research is also focused on developing more methods for clinical help, which are being tested currently and are less expensive and have greater impact and would have greater impact in the future for fighting obesity for long term and in most generation. And these are electric impulses to brain which would suppress hunger, or also genome modification that would be terminal solution for obesity. So thank you for watching, and these are my sources.